what is the transmission period? So many people think that at the end of the chickenpox it will be transmitted. It's not like that. When you have the fever before the rash comes, that is the period where it is going to spread to somebody else. And after developing the rash, another 2 days it will be spreading. So first 2 plus 2, first 4 days are dangerous than the last few days. So many people think that last thing only, so they will be advising the people, you take the crust, put it in Dettol and something else and throw it up, because of that only it will spread. They are all dead skulls. So dead cell cannot have dead virus, living virus. Virus can live only in the living area. So dead skin will not have dead skin, which is virus is alive. So you need not bother about the late stage, but you should bother about the initial stage of the thing. And now we have got so medicine. Many people think that for chickenpox it is a curse of the goddess and we should not take anything. But we have got so many medicines now available. And if you take the tablets early itself, your scar formation will be many problem with the chickenpox. Is the scar which produces. That scar will not go away at all. You cannot remove the chickenpox scar by any method. So we should take the tablets at the earliest possible time so that your scar will not be thing. Second thing is, the virus load in your body will be very less. You will not be able to transmit it to your brother or sister, children, other things. So it prevents the transmission and it prevents the scar formation also. So you have to take medicines. Don't heed to your grandmother or grandfather that you should not take it. So this is the thing. Another thing many people are worried nowadays is fungal lesions. So fungus can affect body whole, or it can affect only the groin or thigh or sometimes nail or the feet alone. So we have got so many names for that, don't bother about it. So these fungus, how it is produced? So for all fungi in our body needs humidity to grow. That is the important thing. So if somebody is having jeans pant, doesn't take bath regularly, jeans is dirty, he is dirty, and he sweats a lot, he plays a lot, what happens? Play produces more sweat within the jeans produces more humidity produces more fungus. So this fungus is going to affect groin, usually the groin area, and from there it can affect other also. You are scratching and you are transplanting it to some other area. So this groin fungus is usually called by the name Dobie sitch. There is no connection between this Dobie and the fungus. Dobie, he will wash the cloth, he will iron the thing, then only come. Because of the heat, it will go off, it will die. So it is not somebody else. Another people are, it is a toilet itch, somebody people call toilet itch. So there is no relationship between toilet and fungus also. It is between us. When we are not taking care of the thing. So what we should do, that is the important thing we should be concerned about. So fungus produces itching and it is sticking onto the clothing also. So when you take a bath, what you should do, mop the areas wherever there is flexural area, armpit, groin, buttock, in between the fingers. You should mop the area, pat with a cloth. Never scrub the area. Many people use the towel to scrub. It should not be done because it will damage the skin also. So you should just pat the area, take away the moisture. If you are a sweaty personality, you put some powder over that groin and armpit area, and this will absorb the water which is going to be produced later, and you will have a dry area fungus cannot live. So that is how you have to apply that. And when you are washing your clothes, what you should do when you are making it dry, on the outside should not be dry. Inside out you should change the clothing and you should dry that in the sunlight. So the sunlight has ultraviolet radiation. Ultraviolet radiation will kill the fungus and you will be free from the fungus earlier than required. So apart from that, you have to take the medicines prescribed by the doctor. That is no other way. And there are some soaps available for that, so that also can be used for preventing the summer. So this is one type of fungus. Another fungus is your pityriasis, themal Tamil. So themal, this white patches over the neck and back, upper back, those who are sweating more, they will be developing it. And this is another minor fungus which doesn't produce anything. It can be in the white color, some people will be having it in the black color also. We call it as a chromic fungus. So don't bother about the tinea versicolor, but if you are worried, you can take the same antifungal treatment, and if you are going to sweat less, it will be and you have to wear a banian or t-shirt with sleeves. So that will absorb more sweat than required, and you will be free from these fungal lesions. So this is one thing. Another fungus is going to affect the people who are sweating because of the games they play outside. So this is called athlete's foot. So athletes, because they are having shoes, so in between the shoes the feet will be like this, and it will be no space in between the toes. It will produce maceration, it will produce a red color there, and it will produce white patches, and this is a special fungus there. So this fungus, we should see that after coming out you should remove the shoes, and the socks should be regularly washed, and when you are going for the game, before applying the socks, you put some powder on the fingers and toes, and then it will be applied, then over that apply the shoes, then this will be cooling effect, it will be a drying effect, and you will not have the fungus. And after getting the fungus, you have to consult a doctor, and they will be giving something to remove the fungus from that area, and to make the skin supple they will be giving some moisturizers also sometimes. So this is the thing we have to do. So this is more important for this thing. Another, many students and adults come to us with allergies. So allergies, we call it as urticaria, skin rash, insect bite reaction, so many things. Urticaria is one common thing which is many people, some idli like things will be coming on the skin. They will be there for 1 or 2 hours, then they disappear. Sometimes your lips will be bulging, and this may be because what you eat. So what are the things that can affect urticaria, the skin rash, hives? In the common man's term it is called hives. So this is produced by some your nuts, especially groundnut, which is the common thing, and chocolates, cocoa, and some other nuts, badam and other nuts that can produce. Any proteinaceous food, egg for some time, for some fish, for some people it may be a river fish, for some people it may be a sea fish. So these are all the things which can produce allergy over the skin. It is an internal thing you are taking, and it is shown externally by the rash, and this we have to avoid those things, no other way. So if you are allergic to fish, you have to forget the fish lifelong. So no other way. Sometimes what happens, after some 2 or 3 years, the body forgets the fish, so you can take. So you have to be wait for the opportune time to take the fish again. So another common problem is fissure foot. Very many people come to us with the fissure foot. So fissure foot is because of the hydration not sufficient over the feet. There is a cracks occurring, like your paddy field. In the summer, if you see the paddy field, there is no water, there will be cracks in the paddy field. Same thing occurs over the skin of the feet also. So this is because of the insufficient hydration of the skin. So you have to take more water, and you may have to apply some moisturizers also for that. This is important thing. Then we have got some skin conditions which are produced due to lack of nutrition. So very common thing in school going children is vitamin A deficiency. So vitamin A deficiency produces a thing called phrinoderma. So phrinoderma is small rough patches over the elbows and knees, and sometimes over the buttock also. So this we have to take internally vitamin A supplementation, and you have to take very good vegetables which contain carrot is one thing, papaya is another thing, so moringa, so that is another thing. These are all the things. Fish contains omega-3 fatty acids as well as vitamin A, sea fish. This should be taken regularly till you get rid of these things. So these are all the problems because of other nutritional deficiencies produce so many things. Vitamin C scurvy produces, you might have read in the science book, and sometimes we need small elements called selenium, manganese and other things. They are required for hair fall. So if you talk about hair fall may be due to so many things. Main thing is nutrition. So if you are lacking in iron, lacking in calcium, lacking in biotin, lacking in selenium, manganese, all these things produce hair fall. Another thing is our hair is a peculiar thing in our body, because we have got around 3 to 5 lakhs hair all over the body, and out of these ladies have 1.5 lakhs over the scalp, gents have around 1.1 lakh approximately over the scalp. Out of these, every day we are shedding around 60 to 70. Out of this 1 lakh roots of hair, we are shedding around 60 to 70, which is normal. Like our skin, which is shedding 50,000 cells, our hair also, out of 1 lakh hair, we are shedding 60 to 70, because they are already dead. So they have to be removed. So hair is in 3 stages. One is growing stage, one is resting stage, another thing is dead stage. So dead hair will be following. Unfortunately, the resting hair also may sometimes fall. Take for example, if I am sleeping over this table and somebody comes, sir, you can wake up and push me out, I will fall, because during sleep the whole body is in resting stage and it doesn't have any energy. So resting stage, we don't have energy, we fall. Many people fall from the berth in the train during sleeping, because they don't have any energy to withstand the fall. They cannot hold, so they just fall, especially children. Similar thing happens to the hair also. So what happens to the hair? Resting hair may sometimes fall. So to combine together, already dead hair 60, combined together with the what is the resting stage. So the resting stage around 20 to 30 can. So in a day, you can lose around 60 to 90 hairs per day. You need not bother about it. And if it is more than 120 or so, you have to come to a doctor and we will be prescribing something regarding that. So this is one aspect of hair fall. Another thing is hormonal. During pregnancy, hair will fall. But after delivery, what happens? After 3 months, it will grow again. So no need. And similarly, there are some diseases which produce hair fall. Typhoid especially. Those who get typhoid, immediately they will be falling of hair 200 hairs per day. But after typhoid is over, another 2 or 3 months, it will come back to normal. We need not. And sometimes treatment itself can produce hair loss. We give treatment for hair loss. Sometimes some treatment, especially cancer treatment. So cancer treatment, when they are taking, many people will be developing baldness because of the cancer drugs. They also produce hair fall to the, especially HIV also. HIV people develop hair loss. Diabetic people will be, because of stress, they will be developing hair loss. These are all the things which produce hair loss. And as far as you are concerned, main thing is going to be nutritional, because you don't take proper nutrition. You always take burger and pizza, and this is not going to give any energy, any nutrition at all. So very good nutritional diet is going to restore your hair. That is the important thing. So what are all the things we have seen? We have to follow some routine so that your skin is maintained properly. So one thing is you have to maintain. Second thing, you should not damage your skin. So what are all the things we have to do? So this is the end point of our lecture today. So how to maintain skin care, that is the main thing. So already we talked about the dandruff and scalp. Shampooing is a must, and shampooing, how to do that, we have already told. So other things what we should do. So you should take regular bath, we have told. So bath, how to take a bath, everybody knows. After bathing, what should be done? We should pat the skin, never rub the skin. So that is the important thing we have to tell. So students, especially over the flexural areas, we have to give care for that also. And another important thing is, after taking a bath, we are going to cut the nails. Once in fortnight also, you have to take the nails. Cleanliness of the nail is important. So what should you do for nail care? For the hand, you should curve the scissors. So in a curved fashion, you should cut the nail. For feet, toenail we call it as. Toenail, you should be straight. You should not take a curved manner there, because if you are taking a curved manner, the nail will grow in. We call it as ingrown nail, and along with the ingrowing, what will happen? It will take the dust, dirt, bacteria, and it will produce infection frequently. And after seeing that, doctor will prescribe, you will clean the area and give medicine. After that, he will trim the nail and give medicine. Then he will take the nail and give medicine. And if you are a diabetic, he will take the toe and sometimes the leg also. For a small thing, we are going to lose one organ itself. So we should be very careful. As far as many people are taking care of, you should take care. After taking a bath, you will be going on rubbing your scalp, because it will produce cold, you think. Sinusitis, it can come. So you are taking care of the scalp, body you are taking the scalp, but unfortunately we don't take care of the nails. So that is the important thing. So if you develop a nail infection, that is going to be a perennial problem, ingrown tail. It will not be easily going. So you should see that after bath, every time you are going to give importance to the nail also. That is an important thing you are going to tell. When it comes to nail, especially toe nails, many people do. So you are going to take a towel and rub the area, pat the area, mop the area, everything. But you forget the foot. When it comes to foot, the water will be there in between the toes. So apart from nail, what happens? In between the toes, the water will be there. That produces a fungus. If you see many people, there will be a small white patches in between the toes. That is called a fungus, candida. So if they develop candida, that can produce infection, another bacterial infection also. They may lose the tail. So you have to give importance to the toes also, toe nails also. This is an important thing we are telling all the students, because this is an important thing, definitely. So that is about taking care of your skin. And food, nutrition is another important factor you have to cultivate. So minimum 6 tumblers of water you have to take. Similarly, 6 servings of vegetables, raw vegetables you have to take. Similarly, you have to take non-vegetarian items which give important thing. Once in a while you have to take some fish, proteinaceous, so your meat produces protein, egg produces protein. So these are all the things you have to consider in your diet. And I always say, don't go for junk food. Junk food produces nothing. It doesn't give you energy, it doesn't give you nutrition. Unfortunately, it alters your hormonal levels. So many girls are developing PCOS nowadays. Many boys are developing from 9th year onwards, they are developing pimples, because all of these are produced by this maida mav. So this maida should be avoided. For that you should avoid the junk food. So that is an important message I want to give it to you all. So this is one thing. This another thing which needs for the maintenance of the skin is very good exercise. So the exercise produces tightness of the skin. So nobody who is having regular exercise will not have a sagging skin. If you see the athletes, they will be having a tight muscle, tight skin also. But those who are in front of the TV eating bondas and other things, they will be having sagging of the skin. So this is an important thing. Exercise produces beautiful skin to you. So any type of exercise which produces exertion of your energy and tightness of muscles and skin is an important, not the indoor games, your carom board and chess. They are nice, but you have to go for some outdoor sweat producing exercises. That is an important thing. And you can go for yoga also. And with the yoga, another thing which we need for skin maintenance is silence, that is sleep. Very good sleep, 6 to 8 hours of sleep is necessary for everybody, and this sleep produces rejuvenation of the skin. So that is an important thing. So nice sleep produces your calmness in the skin also. That is glowing next day. If you are going to have a nice, and if you are oversleeping, that produces a similar effect on the skin, that produces a dullness on the skin also. So it should be never more than 8 hours, ideally 6 hours you need. So 6 glass of water, 6 servings of vegetables and 6 hours of sleep. This is a must for everybody. So this is an important thing we have to consider, we say. There's another important thing is don't damage the skin. So that is, don't apply steroid preparation over this. Many people want to become whiter nowadays, fairer. So they apply some steroid creams over the market. That is immediately it will give you a brightness, but unfortunately over the period of time it damages your collagen. Our skin contains 2 main things. One is collagen, another is elastin. These are important for your tightness and firmness of the skin, but these steroids will produce collagen destruction and elastin destruction. So they produce an old man's effect on your face or other area where you are applying these over the counter preparations available for fairness. So never apply those things. Consult a good doctor and whatever they prescribe, and you can apply that also. So this is another thing. Don't take self medication for any of the things, fungus, whatever it is. Many people are getting some immediate thing from the nearby shop. which contains steroid. So immediately steroid what helps? It will reduce the itching, but unfortunately fungus needs steroid, it will produce more fungus. So don't apply self-medication. And another thing which we need is moisturizers. So we need moisturizers. Those who are sensitive to sunlight, while they are playing, before half an hour they have to apply the sunscreen. Sunscreen will take effect after application, half an hour later only it will start acting. So if you are applying sunscreen, immediately goes out, the damage will be done. Within half an hour sun damage occurs, but after half an hour only our medication will act. Any sunscreen for that matter will act. So you should apply sunscreen half an hour before. And when you come back from there, I already told, wash your hands, face and feet properly. That is another important thing. So moisturizers are needed, sunscreens are. The moisturizer should be applied immediately after bath ideally. So many people are applying moisturizers in the night before going to bed. They think that it will be having for a longer time, skin becomes supple. Unfortunately, it will not happen. So dry skin, moisturizer will not enter into the skin at all. So you should apply moisturizers in the bathroom itself after taking a bath, mopping, and immediately you apply the moisturizer. That will have, if needed for more dry skin, you can. There is a congenital disorder called ichthyosis. I have put up a photo of that dry skin. So there are sometimes dry skin may be due to allergy from the family. Asthma people can develop dry skin. Sneezing people can dry skin. And sometimes there is a condition called ichthyosis. Some square and diamond like thing will be occurring over the skin, dark skin. So this is a dry skin. So for all these things we need moisturizers to be applied frequently. So depend upon the condition, doctor will be preparing. Anyhow, if you take moisturizer regularly, that will be a good thing for your skin. Moisturizer should be applied. So these are all the things we should do. So taking regular food, exercise, sleep, very good nutritional diet, and rest in peace for your mind. All these things will make a long way to produce a glowing, living skin on your body. Thank you very much for your patient hearing. Thank you very much.